So the way I would respond to a physician who tells me that it hasn't changed their management and it's not worth looking at the test is I would ask them how often are they ordering it? Because many times with those physicians, they tend to not order it in patients where they're convinced the nodule is what it is. And granted, in very high risk patients, you're going to go down a certain path. In very, very low risk patients, you go down another path. I've seen physicians that tend to order it in those populations, which is not as helpful because you've already made your decision risk at that point. You're not going to add, if you're 95% risk of cancer, knowing that it's 97% is not going to change your management. I would say that typically in that group of physicians, though, those nodule risks that are sitting between that 5 to 65% and that low to intermediate risk, they're probably not ordering it as much as they should. And I would encourage them to say that those are the population of patients that you're going to find the highest value in. And the fact that it is maintaining initially what your thought process is, that's great. But you're going to be surprised at how many of these patients you're going to find where it will change your management if you order it in the way that it's supposed to be done.
So to a clinician says that Nodify is not helpful for them and doesn't change their decision making, I guess my question to them would be, how often do you use it? And give me an example of how it was not helpful. So I think I would challenge them back to say that if you use this test and it's not helping you, then either you're not following what the algorithm says, right? You don't believe in the Mayo calculator to begin with. You don't rely on the 98+%, sensitivity, specificity, and all that of the test. So it's hard to argue. It's hard to have that conversation with the clinician because it just to me says that they don't have experience. I'll give you an example. When I first joined my practice, my partner said, I don't understand the advantage of an EBIS scope. And I said, well, for my generation, EBIS is the standard of care already. It's not like this is a new thing. It's been around forever. And let me explain to you how it will change. But it took him about 6 months or a year to really understand the value of having, that advanced bronchoscopy there. So the test is the same to me. It's like, if you don't see the value and it's just because you're not using it and you haven't seen how it will affect your patient outcome. But I think we have plenty of literature and publications to show otherwise, that this is going to change what you do next. So if it's not, you just haven't ran the test.